it is almost synonymous to death, or you can say fear.
Yes.
Everybody who hears the word cancer, it is something which is fear psychology is
Absolutely.
associated with it.
Cancer patient actually not only suffers physically, but suffers mentally, suffers financially, suffers socially also. So cancer patient and families, they not only require medical help, but also require financial help, social help.
Welcome to yet another episode of Unscripted with Dr. Sumona, powered by Prante, an initiative to bring healthcare and common man more closer by asking relevant questions to the healthcare experts. Today we have a very special guest with us, a person who has made a point that in life, whatever the difficulty comes, should not be his limitation, but make him more determined and define purpose of his life. A very renowned radiation oncologist who believes that the treatment for his patient is a right dose of therapy and empathy. A great human being, a renowned oncologist. Beside that, he has other roles, that a great administrator. He is the superintendent of AIIMS Bhubaneswar, who make it a point that the AIIMS Bhubaneswar will turn out to be a world-class healthcare facility which is patient-centric. Welcome, Dr. Parida.
Thank you so very much. I thank you because actually you gave me an opportunity, and opportunity in the sense, if we can actually educate maybe 5 people or 50 people, that is immaterial. But if at all actually some information in a positive way can reach the mass through social media.
Absolutely.
Right.
It is not the quantity, but the quality that matters.
Absolutely.
So we will start with your journey. I know you have very interesting childhood. Mm-hmm. Then what made you interested for medical education and then choosing specialization oncology, and how have been your journey during your student life, and then how it all about from the Delhi to Shillong to Bhubaneswar AIIMS finally?
मैं घर में बोलता हूँ I am God's baby. I don't know why I call myself God's baby. My parents actually lost 3 children above me, before me. So I was born premature.
Okay.
Birth weight was 1 kilo 700, and 1965 in Capital Hospital, whatever facility you can imagine. Premature baby. Again, actually, I was supposed to die, but again, God's desire survived. Went to village. At the age of 4, both of my kidneys failed. So I micturate only blood.
Oh my God.
Admitted to Siswaban, 27 units of blood were transfused that time. Going to die again. That time, Barrister Ranjit Mahanti, Mrs. Barrister Ranjit Mahanti, she came, I don't know how, she became savior to me. One day, she visited hospital, maybe in connection with some philanthropic activity. I also don't know how I attracted her attention. She discussed with doctors and she told, I am adopting this child. From today, whatever best you can do, you do. And I started improving.
Wow.
So that's why how miracle happens.
Yeah, definitely you are God's baby.
And the third time we are actually sitting together and talking, and I am a survivor of 2008 Mumbai terror attack.
Oh.
So after that, I put a notice board in my outside my office, whatever I can give and whatever you can take from me. My life is not mine. So this is my life.
Actually, this is an interesting aspect. As you can see, many of us always complain that we have been unfortunate, we didn't get this, we didn't get that. Because of this reason, we could not achieve this. Now you can see a person, a preemie who been in hospital, whose kidney has been affected, but he fought against every odd. Because as we all know, getting a seat in medical college is not an easy job. He must have put his best effort. That is why he is here. So it's an inspiration, sir. It's an inspiration.
Again, I'll bring to your notice and to your viewers. I was selected for 6 technical courses after my intermediate, but my mother insisted because actually your health was not good when you were childhood, so get admission into medicine. But I am again unfortunate during my final year. I always say I am an oncologist by my choice. During my final year, my mother suffered from glioblastoma multiforme and she died. She could not see me as a full doctor.
We really could understand, sir.
That's why I take my profession very seriously and passionately. And it's a standing instruction in my department. Whoever patient comes should go out of my department at least smiling or better than the condition how he or she enters my department.
Absolutely. See, the inspiration when you choose your profession, when you are doing it because of some inspiration where you wanted to change the quality of life, because you have seen your close people could not get that, because of that they are not with you. The kind of pain that you have been through, you don't want anybody else should get it.
Yes.
And that is why
oncology as a subject actually is very close and very emotional.
Right.
You see all the big actually cancer hospitals are all memorial hospitals. Why? Because of this. Like me, I am choice by oncology actually. That time 1990, nobody was taking oncology because the name cancer itself is actually simulates with death.
yes,
So nobody. So all the doctors actually they want to do the patient, actually treat the patient and get the credit. But oncology is actually equal to death. So no doctors want to enter into the field of oncology because the patient will anyway die.
True, absolutely true. But it is almost synonymous to death, or you can say fear.
Yes.
Everybody who hears the word cancer, it is something which is fear psychology is
Absolutely.
associated with it.
So I entered the oncology subject. I thought even if I cannot cure a patient, at least I can talk to the patients and I can share the grief with my patients and I can at least console, so that mentally the cancer patient actually dies, not only dies by physically, they die also mentally, they die also financially, they die also socially.
Totally agree.
So it's my message to the society. So don't fear and don't get scared also when you hear somebody is suffering from cancer or anybody is going to suffer from cancer. It is just like any other disease.
So more than a fear, it should be more awareness should be there.
Absolutely.
More information should be there. And whenever you have any doubt, you come to the specialist. They will tell you the right way, instead of living in a fear or thinking that I might be having because of the different information that is over the social media. It is always good to come to the expert, get yourself checked and analyze whether actually the fear that you have, because if it has been diagnosed, then it can be treated. But if you remain feared and remain scared of it, no treatment can happen. So it is always important.
I'll tell you, Dr. Savana, cancer is actually it's a better disease. How it is a better disease? See, first I'll tell actually how cancer is different than other diseases.
Right.
The only thing, see, you can have actually loose motion multiple times, cancer also multiple times. You can get actually fever also multiple times, cancer also multiple times. But the only difference is cancer happening in one organ, like in lung cancer can go to liver, can go to brain, which no other disease does. That's how cancer is different from other diseases. But the good thing about the cancer, 60 to 70% cancer are preventable. Okay. So we are not actually, the society, the people, the forums are not discussing about the preventable aspect. Whereas the other diseases are difficult to prevent.
True.
So cancer, tobacco related cancers are 50 to 55%. So if we leave tobacco, the cancer goes.
True.
So suddenly 50% drop. But we will not leave tobacco for whatever reason and blame the disease. Similarly, next 10 to 15% cancers are infective. If we take vaccinations like cervical vaccination is there, liver hepatitis vaccination is
Vaccinations
there.
are there.
Yes. So if we take proper vaccination, those 15% is gone. So 50 plus another 15, 65%. So 65%, you please tell me which other diseases are preventable?
Absolutely, absolutely. So where it is preventable and we don't listen to the experts and we don't take the precautions, we are not ready to leave those addictive habits which can cause disastrous consequences to our health, then who is responsible?
Yes.
After all, it is our choice. If we are not taking the step, we are not taking the decision, then we have to bear the burden. We can't say that God is not fair to us. That is why we are happening. You leave tobacco, you live a healthy life, then only you can expect.
Absolutely.
And on this context, if I ask, in your vast career, what do you think with in the past years, how the progress of cancer therapy is happening, and there are various side effects that was initially in the cancer therapy, be it a radiotherapy or a chemotherapy was there. Has it been gone down because of the technological advancements?
There is a tremendous, I am telling you, when 1990 actually I entered into field of oncology, there was nothing. Few medicines and cobalt machine for radiation. The surgical techniques also old. Right now, actually, there is a tremendous changes and good things happened in all fields. In chemotherapy, we are having latest medicine to immunotherapy. The radiation is has become more and more conformal. Conformal means only tumor radiation and very less radiation to the peripheral area, normal tissues. And the surgical techniques has also become from bloodless to conservation right now. And previously it was all radical.
Right.
Suppose there is a tumor in the hand, cut the hand.
Yeah.
And suppose there is a tumor in the breast, take out the breast. But right now, because of actually these developments, we have moved from radical to organ preservation and maintaining the function of the organ.
So as you have mentioned that like other disease, there is a chance of recurrence of cancer even
Yes.
after the treatment.
Yes.
So what will be your advice to those patients who have recovered? How they should keep monitoring themselves, or what should be the routine they should follow so that even if it recur, it get to be noticed in the initial stage and can be again treated properly?
See, cancer actually stage 1 to stage 4. So stage 1 and 2 are curable tumors. If a patient is coming to us in stage 1 and 2, we can actually cure the patient. It may require actually one or more than one modality of treatment, but the patient will be cured. Stage 3 also, actually disease can be kept under control by combination of treatment modalities. But when it becomes stage 4 means metastatic. From one organ, the disease has gone to another organ. Then it becomes systemic and tumor cells actually circulate in the blood. So control means cure is not possible. But depending on the disease, we can actually keep the disease under control for some time and again it will come back. But my question is, why patient will not come to us in stage 1 and 2? There may be some cancers actually, suppose inside cancers like chest cancers, abdomen cancers. Patient may not actually get these symptoms or identify. But the more common cancers, breast cancer is a surface cancer,
Right.
oral cancer is outside cancer. So even cervical cancers in female are also, even if it is not actually surface, but it is not that deep also. So these 3-4 common cancers, if the patients actually they come to us at an early stage, we can cure right now.
Absolutely, absolutely. So any symptoms or signals that you get,
Yes.
it should not be ignored. It should be addressed immediately. Otherwise, if it is too late, it is very difficult for doctors to cure you.
I will again actually bring to your kind attention that actually for our students, we are having actually 7 warning signs. But for general public, I will not tell that because again, you will be confused. So for general public, it is any symptoms persisting for an abnormal period of time. So what is symptoms? Any abnormal symptoms. Suppose actually nose is for to take air, your inspiration or respiration. Suppose blood coming out through your any natural orifices. It may be mouth, it may be nose, it may be anal canal, rectum, wherever, any natural orifices. Once or twice, it's okay. Suppose it is coming out for 15 days, 1 month, 3 months, it has to be investigated.
Right.
Suppose you are having cough. Expected, it will remain for 7 days, 15 days and go.
Sure.
Suppose it is not going after 3 months, it has to be investigated.
Absolutely.
Suppose there is a lump anywhere under your skin or breast. It is remaining same, it's fine. Suppose it is increasing and rapidly increasing. 15 days, 1 month, 3 months, from 1 centimeter to it has become 3 centimeter. It has to be investigated. This is actually just like this. Any abnormal symptom persisting over a period of abnormal time.
So you have to be aware of your body.
Yes. I am not talking about actually it will be a cancer, but it has to be ruled out.
Exactly.
In a very actually higher society group, I was there to give an awareness lecture. Must be some 45, 50 ladies, all higher classes. So I was just actually showing them breast self-examination slides. Just out of my curiosity, I asked them, please tell me, how many of you have felt your own breast? You will be surprised to know, not a single. So I told ki, if this is the status of our higher societies, what about?
How can we expect from them? Exactly.
In the name of privacy or whatever stigma, we are not actually mentally prepared to discuss about the disease and to do whatever actually examination or evaluation we can do for ourselves, not doing.
Absolutely. See, your body, you have to be aware of it. If you have symptoms, if you don't share, who will share? Doctors can't get to know unless and until you come to them or you tell them. So that is very important for all of you to keep yourself self-aware. Being found something difficult, different, go to doctor, get yourself checked. Hiding won't solve the problem.
Breast cancer, because now it is rising like anything.
Exactly.
It has become an urban cancer. Suppose breast self-examination is the first to detect breast cancer at an early stage. And
it's very simple. It's very simple. You touch and if you feel some abnormality, some lumps, just you have to check it whether you are able to locate it regularly. If for 2-3 days you are being able to locate it regularly, there is something is there. Then you consult your doctor.
We say all informations are available in Google. In Google also, breast self-examination, suppose if you write, the picture will come and you can repeat those pictures. And you can feel the lump. And if the lump is persisting for a month, 2 months, you can come to a doctor for clinical breast examination.
Absolutely. Absolutely.
So
as the oncology field is going, and as we are aware that cancer is multi-organ related in certain cases, so as a oncologist, you must have to collaborate or work together with different fraternities of medical fraternities. So how it is being done for a patient? It is like he's coming to oncologist. So how as an oncologist you deal with that, whether you connect them to the nephrologist or it is you through which they get to know what kind of test they need to be done.
First I will tell actually whatever we discussed till now about public cancer awareness, but I will also request my doctor colleagues, my fellow colleagues, they must actually have some oncological bent of mind. Wherever and whenever they feel like, suppose actually there is a possibility, maybe 5%, 10%, 20%, patient may suffer, or whatever disease actually the patient is coming to you, may suffer from any kind of cancer, without losing or wasting any further time, they must refer the patient to nearest oncologist or oncology hospital, where the patient can be further evaluated. What is happening actually, the patient, by the time actually getting referred, the patient is actually reaching from stage 1 to stage 3. So that actually crucial period is also very important. If my colleague, they are having some oncological bent of mind and they can smell, there is sixth sense. All medical fraternity, they are intelligent enough. So they can know. And they should, actually my appeal is, they should refer the patient on time without wasting much time, so that the disease upstage is will not happen.
Absolutely.
Now coming the second part, your question, in our institute, this is institute. I ask always actually what is the difference between medical college and institute. So in our institute, everything is in-house. So there is interdepartmental referral system. If the patient requires some, suppose a liver cancer patient requiring a long problem, pneumonia, we send the referral to pulmonary department. Suppose the patient actually kidney fails, we send the referral to nephrology department. And then doctor comes, examines. If it is possible, they manage the patient here in our department. Or if it requires, they are actually further this thing, they transfer the patient to their side, and after maybe few days treatment is over, they again refer back, send back the patient to our department.
So kind of a multi-faculty treatment is possible, right?
Yes.
And that might lead to a better cure for the patient.
Absolutely.
Because all kind of experts are available together and they are putting their brain for the recovery.
My mentor always says more brains are always better than single brain. So we always encourage, we discuss on, not like actually other hospitals. Here in round, we are having 6 levels of students. Undergraduate, junior resident, academic junior resident, senior residents, assistant professors, pool officers, like this. So, and any kind of patient actually tumor board, it is discussed. All single cases are discussed in tumor boards with multiple people. So there is no mistake, even by mistake. We say it. Like
so all kind of risk analysis is being done, and then it is being progressed. That is wonderful news for the patients, that they are actually in the safe hands. As we have discussed previously about the technological progression that has happened. With the technology, there are various things, that the positive and the negative that comes. As we get to know that the machines are there, machine learning is there, artificial intelligence is there. There's many ways they are actually assisting and helping the medical science. But at the same time, do you see there is some kind of disruption that is happening? Are you seeing that between the doctor and the patient, some unknown technology is coming in between and making them apart? Or it is something which we're really looking forward to?
I always say, who is the person sitting behind the technology? It is not the technology, because technology does not have any emotion, does not have any tactile feeling. So technology is very emotionless and straightforward. So technology makes the machine error-free.
Right.
So up to that, we take the help of technology. But when we require which is the person to get treatment, how the patient will be counseled, how the family will be counseled, there actually the personal relationship, the mental support, the personal touch, personal counseling come into play. See, as I told you, cancer patient actually not only suffers physically, but suffers mentally, suffers financially, suffers socially also. So cancer patient and families, they not only require medical help, but also require financial help, social help. So by talking to patients, as I told, when in 1990 I joined the curriculum of oncology, that time not actually much technology, much innovations, much chemotherapy was available. I entered the field only just to actually, if I can give some relief by talking to the families and to the patient. So by talking, by touching, you can relieve at least 50 to 60% of stress portion of the patient and families. And now coming to the technology, there is everywhere, technology is everywhere, starting from routine technology to AI, artificial intelligence. Right now, artificial intelligence is everywhere. In our cancer also, we are having machine learning and artificial intelligence. But I always teach, always human intelligence is always better than artificial intelligence, because human intelligence will choose whichever artificial intelligence will be required for a particular patient. So all patients, patients are different, and accordingly their treatment is also different. You cannot utilize the same technology, same kind of artificial intelligence for all patients. So the human intelligence will decide and customize which kind of artificial intelligence is required for which patient.
So kind of a assistive function
Yes.
they can do.
Yes.
They can be a best an assistant to providing the information in a certain layout, so that the doctors actually who have been studying, who have been able to understand what is the meaning of these the features that they are seeing through the diagnostics test that has been done, and can decide upon the treatment. So instead of doing the Google search and just reading your report and starting your therapy, it is always advisable go to the professionals, go to the doctors who has really spent years after years to understand these diseases and their therapies.
When actually people feel more and more excited about artificial intelligence and technologies, I just ask them one question: who has invented these things? This technology and artificial intelligence. Who was?
Exactly.
This
So
human,
we are human.
human being. When human being brain has produced these things, how they can better than human?
Exactly.
Yes. Very simple.
So we coded them, we made them. How can they be better than us? Of course, we realize they are there to reduce our burden.
Yes.
They are there to reduce our burden, not to overtake us. And we have to be very judicious and thoughtful in those terms, at least when it comes to your health. If we talk about all these things, I also feel that being so emotional, as I can see, and so connected to your patient, and being, as we know, in cancer, there is a lot of difficult news or difficult situations that you need to handle. How you are managing it?
I say actually human brains are not like computer. You press escape switch or delete switch, actually everything will be deleted and you come back to. I tell only two examples and then you will understand. I lost my mother in 1990 because of glioblastoma multiforme, because our textbook writes ki survival in glioblastoma multiforme is between 6 to 9 months. Then it's okay. Time passed. I went to AIMS Delhi. 2002, 2003. One day I saw during I think 9:30 at 10, one lady is standing near the nurse's counter. I thought must be actually attendant of some patient. So as senior resident and pool officer, we visit the ward maybe some 20 times, 30 times, sometimes 40 times. We just actually have to run around here and there. Around 5:36 in the evening, I saw the same lady standing there and crying. So I thought again, maybe patient must be sick. So I completed few pending works and asked the sister in the counter, why the lady is standing there since morning to evening? Is there some problem? Then she told, no, sir, her patient is not here. She has come for some inquiry and standing there and crying. Then I thought, this is not all. For some inquiry, why somebody should stand actually for the whole day? Then I called her to my duty room and asked. And she just actually cried and cried. Then she told, sir, my son is suffering from some brain tumor and doctors are saying only few months. Then I asked, show me some papers. She showed me the paper, CT scan. It was same glioblastoma multiforme. And the boy was 8 years old.
My God.
So she told me, he's my only child. And now see, God is so cruel, this, that. And she caused her fate. I told you, okay, what has happened, happened. So tomorrow morning, please bring the child. Let me see. And let us do the further treatment. And where is the father? She told me, father cannot come to the department because he is totally lost. Listening the news, his son will not survive beyond few months. I told her, okay, so what to do? She told me, I also don't understand. I told her, you just bring the child and let us do the treatment. She told me, I am not sure, but because you are insisting, I will bring the child. Tomorrow morning, next day morning, actually, she brought this thing. I myself cursed after looking at the child, myself cursed myself. Punjabi boy, 9 year old, actually, per my height, and he was looking so handsome. I thought, how God can be so this thing. But barring this emotional, I told you how we balance actually became emotional for 2 minutes and again
Started treatment.
started plant treatment. That time, temozolomide, the wonder drug, actually it came to the market just during that period. So I called a company fellow and requested him if he can support uh, this child treatment for radiation. The boy was treated with radiation plus temozolomide, and after that I left AIMS Delhi in 2004, joined Shillong Institute. You will not believe the boy survived. Forget about 6 to 9 months. Survived until now also. He is alive.
Wonderful, wonderful.
And the boy actually went to school, went to college, and for everything, her mother calls me and cries.
And your mother must be very proud about this fact.
And I'll tell one more story. Here in Bhubaneswar, one day, young lady, maybe 27, 28-year-old, standing near my door, and with her actually a young kid, maybe some 4 5 years, crying. I called her inside, asked if what has happened. During the process of discussion, she told, I lost my husband because of some accident 15 days before. And now doctors have diagnosed my child with a chest wall tumor. I don't know whether this is the time to me to grip for my husband or to move with my child from hospital to hospital. So this is life.
Absolutely.
So anyway, all doctors actually see life from very close this thing. But being in oncology, we see the life, the suffering.
Absolutely.
From the closest.
Actually, the darkest phase, yes. when the people are become hopeless.
Yes.
At that time, they come to you, and you not only have to treat them, bring back the hope into them.
That's why I told you is 30 to 60%. If we talk to them, if we touch them,
absolutely,
the stress component.
Exactly. Empathy is the best medicine that one can have at the time of stress. And if we can bring in change with our two nice words with them, nothing more can be expected, because it is in the life where there is so much of stress, and if we can bring in little happiness, little hope, that is enough for that person who is actually in the bottom of his or her life to get the new fresh enthusiasm so that they can start fight back again with a new energy. It's amazing, sir, talking to you and learning about how you've been able to bring a lot of happiness and lot of change and lot of energy and lot of enthusiasm and lot of hope in so many people.
I say, I may be actually a director or I may be medical superintendent. Suppose right now I am not carrying my purse. If you ask me 100 rupee, I cannot give. But 100 rupee is a giveable thing, producible thing. But when you come to your inner happiness, your inner energy, your inner strength, if you do not generate for yourself, how you motivate people working around you?
Absolutely.
The patients coming to you. Patients come to you with a hope. If we ourselves are demotivated, stressed, how we motivate?
I can totally agree with the fact that you are so motivated. Understanding from the very beginning,
Yes.
when you born, you have struggled so much, you have been through so much of sorrow, but still you kept yourself strong and you always thought that what I have lost is okay. I won't let that happen to the rest of the people.
God, that's why again at the end, actually conclusion, I say ki, I am a God's baby because God is kind enough.
Exactly.
In spite of so many negative things, He has given me inner energy.
Absolutely.
I may be not actually physically strong, but the inner energy is just adequate to make others happy and motivate. Keep
That is
them
what
motivated.
is most important, sir.
That's it.
So, if we think about our next generation, it will be great if you can share some of your thoughts, some of your message for them, how they should treat the life, how they should think to take the life ahead, and if someone is thinking about joining medical fraternity, what should be their thought process?
I don't know, Dr. Saab, actually these days, wherever you go, whomever you speak, they say busy.
Yeah.
I take it otherwise. They may not be actually physically busy, but they remain
Mentally busy.
mentally busy. Mentally busy actually kills you. What we say, stress is the biggest killer.
Yes.
People say me, cancer is the biggest killer, road traffic accident is the biggest killer, the cardiac disease. But I say no. Stress is the biggest killer because stress produces all three.
Exactly.
Stress actually leads to, if you are going traveling on road, stress produces accidents.
You're not focused.
Yes. Stress produces your cardiac disease. Stress produces cancer in our body.
Exactly.
So stress is the biggest killer. So you have to the younger generation, they may call themselves Gen Next, but you have to find out yourself actually how you can keep yourself stress free.
Inner peace. You have to get that inner peace within you.
That is, you stay with your family, you stay with your friend, or stay alone, or stay in space or earth. You have to find yourself your own way to keep yourself stress free. That is the one line I can.
Yeah, absolutely. And don't get stressed because what society is expecting out of it. It's your life. It's your decision. Be relaxed and do best what you can do. Thank you, Dr. Saab. It's wonderful talking to you. It's really so much of learning that I got and my audiences would have been. It's really amazing interviewing you. I'm really grateful for your time. Thanks a lot. Thanks a lot.
I'm thankful to you and your team. And if actually I'll feel happy if I have educated few of your viewers even.
And in case if you have any doubts, you can write it in the comment. We'll try to address that. We will pass it on to the sir, and he will definitely get back to you.
Please. Thank you so very much.
Thank you. Thank you very much.